Hi, and welcome back to the third in a series of informational videos about nutrition and pancreatic cancer. These videos are being brought to you by Wellspring, in partnership with Pancreatic Cancer Canada. My name is Rachel Reed, and I'm a clinical dietitian specializing in the care of cancer patients at the Odette Cancer Centre in Toronto. I'm delighted to be able to share information with you about pancreatic cancer and nutrition. I will be providing a series of 4 short videos focusing on symptom management, the importance of pancreatic enzymes, diabetes and pancreatic cancer treatment, and this video, focusing on pre-surgery nutrition. Today we will briefly review the various types of surgery for pancreatic cancer and focus on the benefits of good nutrition pre- and post-surgery. The best part is at the end I will also share with you some recipes for some wonderful, high-calorie, high-protein smoothies. So let's get started. There are a few different surgeries that a person with pancreatic cancer may undergo: a Whipple procedure, a distal pancreatectomy, or a total pancreatectomy. The Whipple procedure is the most common surgery for pancreatic cancer. It is a large surgery and generally involves removal of the head of the pancreas, the duodenum or part of your small intestine, a portion of the common bile duct, the gallbladder, and sometimes part of the stomach as well. After these structures are removed, the surgeon will reconnect the remaining intestine, the bile duct, and the pancreas. Because this is such a big surgery, it is important to properly prepare your body beforehand. Doing so will give you the best possible outcomes. In fact, many healthcare professionals now equate surgery to running a marathon. Both of these things put tremendous stress on your body. It is widely known that proper nutrition is a key factor for the performance of athletes, and those preparing for pancreatic cancer surgery should also think about nutrition in the same way. Malnourished patients tend to have increased complications and death following surgery, longer hospital stays after their surgery, and an increased chance of needing to be readmitted to the hospital after their surgery. So how can you prepare nutritionally for surgery? Firstly, you need to eat enough calories. Our number one goal heading into pancreatic cancer surgery is weight gain or stabilization. Many pancreatic cancer patients lose weight at their time of diagnosis. If surgery is planned, you will want to prevent any further weight loss and instead aim at gaining or maintaining your weight in the weeks prior to the surgery. This will help replete any nutritional deficiencies you may have. You should aim for 25 to 35 calories per kilogram body weight a day. This means that a 65 kilogram person should be eating around 1,600 to 2,300 calories per day to maintain their weight. If you need to gain weight, you should add an extra 500 calories to that number. The best way to figure out whether you're eating enough is to monitor your body weight. If the scale is going up over time, you're eating enough to gain weight. If it is staying around the same number, within 2 or 3 pounds, you are eating enough to maintain. If over time it is going down, you are not eating enough to maintain your weight. The second thing you should do to prepare for surgery is eat enough protein. In times of stress, we need more protein in our body. This is because more protein is needed for immune functioning and wound healing. Cancer patients and surgical patients should be aiming for at least 1.2 to 2 grams of protein per kilogram body weight every day. This means that a 65 kilogram person would need between 78 to 130 grams of protein daily. If you are also having kidney issues, this should be discussed with your healthcare team first. The best sources of protein in our diet are meat, so things like chicken, beef, pork, or lamb, fish, eggs, tofu and other soy products and beverages, dairy products such as milk, cheese, and yogurt, nuts and seeds, beans and legumes, and protein supplements such as whey or soy protein powder. Now let's talk about some helpful tips to help maintain good nutrition prior to cancer surgery. Firstly, try and eat several meals and snacks during the day, aiming for eating every 2 to 3 hours. This will help make meeting your calorie needs more manageable. Every bite you eat adds up at the end of the day. Try not to skip meals, as this can be difficult to make up for later in the day. Try to have a source of protein at every meal and snack. Often people forget about protein at snack time. So, for example, instead of having just a piece of fruit, include some nuts or cheese to add in healthy fats and proteins, which will make your snack more balanced. Make every bite count by focusing on high-calorie, high-protein foods. This is especially important if you are struggling to eat and to maintain your weight. Foods like cheese, nuts and nut butters, avocado, healthy oils, meats, fish, and dairy products like milk and yogurt will help you maximize every bite of food that you are taking. Try to drink high nutrient fluids. These not only help you stay hydrated, but they are also a good nutrition source, especially if you're struggling to maintain or gain weight. Focus on milk, sports beverages, juices, soy beverages, smoothies, and soups. You can also try commercial nutrition supplements such as Ensure and Boost. These can be a convenient and tasty way to increase nutrition. They are high in calories and are pre-prepared, so they require minimal effort when you're feeling unwell or you're unable to prepare a snack for yourself. I hope this video provided you with a better understanding of the need to boost your nutrition prior to undergoing pancreatic cancer surgery, and some tips for how to do this effectively. Now, as promised, here are a few recipes for some high-calorie, high-protein, and high-taste smoothies that can help you get the added calories and nourishment your body needs.